So, do eye doctors have a love hate relationship with treating dry eyes? Are there some eye doctors that just hate treating dry eyes? Well, in this video, we're going to go over three reasons why that might be. And you'll probably find that these same three reasons patients share as well, 10 times more than eye doctors do. And so, let's focus in. Now, you'll probably notice during this video is live. So if you are here, definitely say hi in the comments where you're from. At the end of the video, I'm going to do a Q&A. So if you have any questions, definitely stay for the end of the presentation. And I'll see if I can answer some of your questions. And also as a disclaimer, these are just my opinions in this video. There are some eye doctors that love dry eyes. Some eye doctors hate it. Somewhere in the middle. But these are some of just the frustrations that I hear from other doctors that some of my doctors share, some frustrations that patients share as well. And so I just want to go over that because a lot of people ask me, especially on YouTube videos, why did my eye doctor never tell me about this? Why has nobody taught me about this or talked about this? And so I wanted to go over some of the reasons why that might be, just to kind of get a better understanding. These are just kind of my thoughts type of thing. Now, number one is cost. And like I said, patients are going to feel this. Dry eye patients are going to feel this 10 times more than eye doctors do. Now, if you are a dry eye patient, and likely if you're watching this, you have dry eyes, you're going to agree with this one because even just getting artificial tears, if you use artificial tears chronically, using it every day, go and get your eye drops at the store, that cost can add up just by doing the artificial tears. And nowadays, there are a lot more dry eye products out there. There are a lot more diagnostic tools that doctors can get, procedures, in-office procedures that we're going to talk about. And the cost can add up, and it can add up fast. And so these are just a sample of some products here. So we have the artificial tears, eyelid wipes, new lids, warm compresses, dry eye glasses, prescription eye drops. I mean, yeah, the cost can rack up really fast. Now, on the doctor side of things, more and more these days, you'll start to find more diagnostic tools that a doctor can bring into their office to diagnose dry eyes appropriately. So if there's myopography, we can take pictures of the meibomian glands, tear lab to take osmolarity of the tears. So there's things that doctors can purchase or invest in to bring into the office. And then there are procedures that we can do on the patient in the office. So IPL is a big one to kind of reduce inflammation and help dry eyes. But IPL, if a doctor wants to invest in that, depending on what you get, it can get close to $100,000 for that machine, for that tool. And so costs $100,000, and then to give that to the patient, it can cost the patient a lot of money just to get that procedure, and usually takes multiple procedures to actually notice improvement or notice an improvement in their dry eyes. And so it's definitely an investment on the doctor's side of things to get diagnostic tools and procedures that they can bring into the office, and then be able to recommend that to the patient, knowing that it's going to cost a lot of money. And that's the thing, is a doctor treating dry eyes has to feel confident and comfortable to be able to recommend certain treatments to patients. At the end of the day, these are our patients. That, at least that's how I feel. I feel responsible for them. I want to do the best I can, help them the best I can. And so I want to be able to provide these certain treatments to these patients, knowing that it could help. But at the end of the day, we have to be able to look at them in the eye when they come back as our patients. And sometimes it can be hard because dry eyes can take a while, and sometimes these treatments don't give adequate relief to the patient. So it can be frustrating, but but costly at the same time. So that's why some eye doctors I just do not like spending that much money. And some eye doctors do, to be able to provide it for the patients. There's that love-hate type of thing. Again, patients feel this 10 times more, 10 times more than doctors do. So number two is time. It takes so long, or it can take so long, to treat dry eyes. And patients will know this better than anybody. Sometimes dry eyes can take months to years to even make some improvement. And so usually you'll have definitely some follow-up visits that you have to go back to the eye doctor for to see if the treatment's working, to see how the ocular surface is doing. And it just takes time. And so usually there's an analogy that a lot of doctors will give, is that it's kind of like if you go on a diet. You want to shed some pounds, lose some weight, but it's never as fast as you want it to go. You wish you could go on a diet and be able to lose 20 pounds in a week, and I guess, some instances, extreme instances you can, but that's how dry eyes kind of is when you get on a treatment, start a treatment, you want to see improvement as fast as possible, but sometimes it just takes time. So there's multiple appointments involved, different treatments, and making tweaks to the treatments, and it can get really frustrating. I mean, there's some treatments that they know is going to take a long time. So, for example, Xydra and Restasis prescription eye drops can take 2 to 6 weeks just to see an improvement, depending on what you get. Like I said, IPL, multiple treatments before you see an improvement. Sometimes people can see improvement, after the first treatment, but usually people get better and better the more treatments they have. LipiFlow is the same thing. Hopefully you can see improvement on the first treatment, but it is repeatable and oftentimes needs to be repeated. And so this just can be so frustrating for the doctor and the patient. And so you'll find that patients will come back not really having much improvement, or not as much improvement as they want. Maybe they'll go to a different doctor for a second opinion, which is good, can be good, but sometimes they'll feel like to the patient that they're starting over. And on the doctor side of things, they can put a lot of time and energy into a patient to help them and not, see the results that they want to. And then the patient will leave, for the second opinion. So they'll kind of drop out. So the doctor can get kind of burnt out, trying to help the dry eyes and then just not seeing the relief, that he wants to. Same with the patient. And so as eye doctors, we kind of are in a profession where we're accustomed to seeing results like that. If we want to see someone for their eye exam, they've never had glasses before, we could get them glasses, and it's all of a sudden we'd like change their life like that. They walk out of the office and say, holy cow, I can see the leaves on the trees. It's like that instant reward. Or we put someone in contacts and there's just that instant reward with the contacts and convenience. Or, there's people with eye diseases like keratoconus, and we fit them with scleral lenses and get them seeing the best that they've seen in years. There's just that instant gratification or instant reward to the doctor. With dry eyes, it can take some time. And so an eye doctor might not be used to having to put that much energy into helping a patient. And that's something that we all need to be better at. All eye doctors, including myself, just have to be diligent in helping these patients with dry eyes. But a lot of doctors can be like, I don't even want to touch that. I want the instant gratification type of thing. So number 3 is research and technology. So now this one can be actually a good thing. Now, a lot of eye doctors, including me, will say that we are kind of in a golden age of dry eye research and treatment. I mean, just in the last 5 to 10 years that I've been practicing, dry eye research and treatment and tools, diagnostic tools and everything have just exploded. Which there's so many products out there. That's where a lot of the money is. So it's kind of, a double-edged sword type of thing. But there's just so much that have come out in just the last, 5 years. I mean, more focus on meibomian gland dysfunction, checking the meibomian glands to make sure that they're working correctly. It just can be overwhelming for the doctor. Now, along those same lines, I say, if you are a doctor and you're not actively engaged in the dry eye research, knowing what new tools and treatments and procedures are out there, in 2 to 3 years, you could be in the dark ages. That's how fast dry eye treatment is moving. And just with doing YouTube videos, like I'll do YouTube videos. There's so much out there. These are just a handful of dry eye videos that I've done. I mean, you could have a whole YouTube channel on just dry eyes, and I'm only scratching the surface on videos that I could do about dry eyes. There's so many people that ask me questions that I want to do a video on. that I need to do a video on. I'm just scratching the surface. And here's an example. So here's a video that I did 2 years ago. This is a 2 year ago. This is actually one of my first videos that I ever did. It's actually kind of cringy to watch right now because I put the music too loud and everything. The information in there is still good, but when I watch it now, the information there's just better information now. So there's more treatment and research that have come out where I would change what I say in that video. It's still good, but I need to remake this video like once a year, with new updated information. But that's how fast it goes. And so if you're an eye doctor that's not interested in dry eye, not actively researching everything about dry eye, in 10 years time, you will be left in the dust. I mean, that's when you'll find eye doctors that will just not even want to touch dry eye because it's just so overwhelming, so much. And so eye doctors need to be better. I mean, including myself. we need to do a lot better, actually. And so this is where you'll find that right now in the eye care world, you're going to find more and more practices actually specializing in dry eye. That's what they do. They have a clinic that's a dry eye clinic, dry eye practice. They bring in all the diagnostic tools, all the procedures, everything to offer a full patient. They don't do normal exams. That's what they do. And then on the other side, you'll find eye doctors that don't even want to touch dry eyes. In fact, they're getting more and more to where they're just referring to those practices. If they have a dry eye clinic next to them, they'll just refer over there. And then you'll find a lot of practices that are starting to bring these into their current full scope practice. And that's probably how our practice is that I practice at. We have IPL, LipiFlow, certain diagnostic tools in our office so we can provide that to our patients. So you're going to find that more and more nowadays as well. But that's where you're starting to find this divide of some eye doctors that won't even touch it, hard to even educate the patient on it. And so you'll get some patients that are going like, wow, my eye doctor never even told me about this. Why didn't they say anything about this? They just told me to get some eye drops. And some eye doctors are just, boom, they're in it, specialized, full on clinic type of thing. And that's sometimes what patients need. And so the overall thing, and this is what I feel is, dry eyes can be very, very rewarding, more rewarding sometimes than, hey, providing glasses or contacts, because this is something that you kind of get into the trenches or in the battle with the patient. And if you can find a way to help a person in their dry eyes, it can make a significant difference in their life in the long term. And so it can be really rewarding. It can also be very draining. Same thing with a patient, draining to treat and educate a patient. Sometimes when patients come in just for their normal eye exam and I notice that they have dry eyes, or they're mentioning like every once in a while I get dry eyes, it's easy to get caught up and just start talking about dry eyes. I could be with that patient for 2 hours just rambling on about dry eyes. It can be tricky to to manage the time because a lot of times you'll fall behind and then the next patient's waiting, and so it's tricky. And so dry eyes is one of those things that you can easily get lost educating patients about. And so it can be very draining because some doctors be like, I don't have time for this. I can't do this type of thing. And so it can be tricky. But yeah, so like I said, more and more nowadays, you're going to get more and more dry eye practices or more practices that are bringing in these procedures. So I think it's going to get better. I think we have a long way to go as eye doctors in the research and how we treat patients and everything, including myself. But I think we're making improvements. And I'm kind of curious to see what it'll look like in another, 3-4 years. Now, one thing that I was going to bring up, so on this technology here, so right here, these are just eye drops that have come out either last year, coming out this year, or next year. I mean, 10 years ago, what we had Restasis and then some steroid eye drops. I mean, that's what we had, and like warm compresses, we're kind of limited. Now, I mean, just within a year or two's time, and we have new eye drops just boom, boom, ready to come out. Last year, there was Tear Eye Tear 100, wasn't an eye drop, but neurostimulation treatment for dry eyes. This year just got approved MIBO. It's for a specific eye drop, first of its kind for MGD, meibomian gland dysfunction specifically. Pretty soon we're going to have TP03. This will probably have a different name, but it'll be for Demodex blepharitis. We're going to have one for inflammatory dry eye and keratin production. Sometimes you get meibomian gland dysfunction from actually keratin, like the actual oil glands kind of get a hardened crust of skin tissue over the pore, and so they get meibomian gland dysfunction. So yeah, that eye drop will be coming out probably next year. So we do have a lot of things coming out, and it's hard. It's hard to stay on top of it. You have to be actively engaged, and that's something that I have to constantly challenge myself to stay up to date with the current technology. So it can be tricky, but also very, very rewarding. So those are just my thoughts. Like I said, disclaimer is those are my opinions. I just want to kind of share my thoughts because a lot of people kind of ask me the same question. So I wanted to do a video. And if anybody has any questions, now's a good time to ask them. And just as a disclaimer, I can't diagnose or recommend specific treatment without actually physically evaluating an eye. And so I can't do that. I think it'd be unethical, but I can answer questions in a framed as an educational point of view or my experience or what my patients have experienced type of thing. And yeah, like I said, if you don't have any questions, you can leave it in the comments. So later, if you come up with a question, you're like, ooh, I'm kind of curious about that. I try my best to get to the questions in my comment section. So I usually do pretty good at getting to that. So, but yeah, if nobody has any questions, like I said, you can leave it in the comment section. Yeah, like I said, this is one of those videos that I've been wanting to do for a while, and I, just because people have asked me, I was actually kind of nervous to do this video because I don't know what other doctors think, and I didn't want to come across as complaining or anything because I actually find dry eye rewarding. But these are just some of the frustrations that come out as eye doctors here. So, so we do have a question here. So we have so Hurricane. So he says, how's dry eye caused, or what's the cause of dry eye? And see, that's a good question. I was actually going to put a slide in there because I was actually starting to count up the list of causes of dry eyes, and we're getting close to 100. We're getting in the hundreds of what can cause dry eyes, whether it's a mixture of genetics. Certain genetics you can cause dry eyes, but there's definitely diet related, environmental, screen time, staring at screen times. If you're prone to inflammation, if you have certain foods that you're eating that's causing inflammations or inflammation, there's certain causes that you can't control, like autoimmune disorders. Blepharitis, if you have an overgrowth of bacteria on your eyelids, can inflame the eyelids, cause meibomian gland dysfunction, then cause evaporative dry eye, which can cause a whole host of issues. So sometimes you got to really treat those eyelids. I have a lot of patients that have lacrimal gland problems. So meaning that lacrimal gland isn't producing enough tears, enough of the water part of the tears. And that can be from nerve issues or actual gland issues from certain medications they took. Certain medications can cause dry eyes. And so it's, the list. I should do a video on just the causes of dry eyes. It would probably be a 30-minute long video. but yeah, there's just so many different causes. Probably the common causes of dry eyes right now is probably screen time. So staring at your phone and your TV, not blinking enough. There's definitely a lot of, that can cause dry eyes in a lot of people. And then diet is a big one. If you're low on omega-3s, high on omega-6s, eating inflammatory type of foods can cause dry eye for sure. Okay, so this one says, will you be making a newer video on the new treatments for dry eyes? Absolutely, yes. This is a question a lot of people ask me. I don't know if I want to do a one video. I might do that. Maybe I'll do a video that will just say, hey, these are the new treatments, kind of give a quick summary of dry eye treatments that are coming out this year, because a lot of people actually ask me that. But there's certain drops like Mibo that just got FDA approved. That I might do a full video on just that alone, because I think it is interesting, kind of a first of its kind type of dry eye treatment eye drop. But yeah, I definitely, those are on the top of my list of the videos to make. I just need the time to film them is the thing. Yeah. Okay, so this one, can I study with severe dry eyes? Now, he brings, or he or she, sorry, brings up a good point that a lot of people will have severe dry eyes, and it will completely crush them. So meaning like certain things that they want to usually do, study, work on the computer, driving, can sometimes get them out of being able to actually function during the day. Now, you can study with severe dry eyes, but if you have severe dry eyes, you should be on top of what has caused the dry eyes, if you know that, but also your treatment. So if you just need to be careful when you're studying. So if you're studying on the computer screen, you need to be taking your breaks, sticking with that 20-20-20 rule. Every 20 minutes, taking a 20-second break, looking 20 feet away, using your eye drops periodically during your study time. The other treatments that you need, if you have to do eyelid wipes or anything like that, or if you have specific eye drops, doing anything with severe dry eyes is an extra challenge that requires consistent dry eye treatment and everything. Because if you don't do anything, if you're staring at a screen and you know you have dry eyes, even after a few minutes, you'll start feeling it. Things might get blurry, your eyes will start hurting. And so it can be a challenge to get you to a point to where you can study, but I do believe that most people can get to a point where they can control their dry eyes enough to study. Okay, let's see here. So I live in Guatemala City. Wow, welcome. Thanks for watching. Have you heard of cyclosporin A as a dry eye treatment? I was recently prescribed it. So cyclosporin is in the, here, let's see if I can give you, so in Restasis, so where there's Restasis and Sequa. Well, I was hoping that you could see that a little bit better. So, so there's a cyclosporin right here. Is kind of like a medication that can improve your dry eyes, your aqueous production, kind of decrease inflammation. So it is a dry eye treatment. Been around for a while. There's Sequa now that's a little bit higher dosage, and Xiidra is kind of like the competitor. It's a different medication, but it can help. Some people find better treatment. Some people find other treatments better. It totally depends on the person, but that is something that's commonly prescribed for dry eye for sure. Let's see here. Let's see. Okay, hi doc. I have blepharitis on the left eye, bottom eyelid. Not too much discomfort, but thickness. I have done all stuff like compresses, IPL, and it's the same since 4 years. Will this go away? Ooh, okay. So good question, and a lot of patients will have this question. So from my experience, so it's, yeah, like I said, it's hard to know without evaluating your eye and like looking at it type of thing. But blepharitis, so I actually suffer from blepharitis as well. Sometimes I'll have bouts of it that go stronger. Even if I'm doing my dry eye routine, it'll just all of a sudden like flare up. I don't know if I just all of a sudden eat the wrong food or I rub my eyes too much or something. And so it will flare up. Now, will it go away? With mine, it's almost like it doesn't go away to me. I can get it controlled and get it, worked back, and then it'll kind of flare back up. So in my mind, I can control it to where it doesn't really bug me or affect me. I can control my dry eyes from the blepharitis. Yeah, I was going to say, sometimes there's a lot of Demodex that's involved in that. So IPL is something that is helpful for Demodex, but if it's a type of blepharitis that isn't going away, that's something to look into. If you haven't, some patients will have Demodex mites that are on the eyelids that can be causing this blepharitis, and it's harder to get rid of. Like sometimes you can look into tea tree. A patient can look into tea tree oil wipes or treatment, but IPL is a good one. And then right now there's going to be that medication that's going to be coming out for Demodex blepharitis. That's that one that has like kind of the weird name, the TP03 here. Let me show you here. Yeah, the TP03 Demodex blepharitis, because there's a lot of people with blepharitis that just they use eyelid wipes, IPL, and they might help a little bit, but won't get it gone. And so that'll be interesting to see how this drop works when it comes out. And so that might be something to look forward to. Okay, what is retinal detachment? Scary stuff, can be scary stuff. So retinal detachment, the retina is the tissue, the inner lining of the back of the eye, where blood vessels are and everything like that. Sometimes people get a retinal detachment where that retina will actually rip and start separating the visual cells in there. And if it's bad enough, can rip and go completely and rip off the macula, which is the center of your vision, and go blind from it. So it's a pretty serious condition to catch it as fast as you possibly can. So if you're getting floaters, flashes of light, it's not something you want to wait on. Just go into your eye doctor, get it checked out, because that's one of those conditions that gets pretty serious. That's one of those conditions where if eye doctor is sitting at home, sitting on their couch watching a movie Sunday night, and they get an emergency call, and the guy says, "Hey, I just have floaters, flashes of light," boom, we just run right in there just to make sure it's good. So that's one of those deals you don't want to wait on. Okay, sir, I'm from India. My Schirmer test is 4 millimeters for both eyes, but I may have evaporative or aqueous deficient dry eyes. So if you're asking like if you have evaporative or aqueous deficient dry eyes, sometimes it's hard to tell just from the Schirmer test, because it can, but usually with the Schirmer test, you're kind of trying to diagnose if they have aqueous deficient, meaning they're not producing the water portion of the tears. Now a good portion of people, the majority of people, up in the 80% actually have a combination of both. So they're evaporative and aqueous deficient. And so it's hard to say just from the Schirmer test like what you have. But there's a good chance that you'll probably have a combo or aqueous deficient. But that's again something that may require multiple different tests to accurately diagnose, and so it can be tricky just from the Schirmer test alone. But that is something. So the Schirmer test, that is something that a lot of new treatments that are coming out, they use that as kind of a tool to show, hey, look, we improved the production of tears. So kind of like Tyrvaya and iTear 100 with neurostimulation, they actually use the Schirmer test to show that, hey, tear production improved, over a month's time of doing the treatment. And so if that's kind of just the only thing that's deficient, the Schirmer test is kind of low, so you really do have aqueous deficient, then that might be something a patient might benefit from Tyrvaya or iTear 100 to kind of get those tears producing there. Let's see here. What sorry. Ooh, okay, almost missed it here. Hi, Doc. Can I use Optive Fusion eye solution for dry eyes for the usage of contact lenses? Optive Fusion eye solution? Optive Fusion? What? See, there's so many eye drops out there. Here I am looking at this. Eye drops. Optive Fusion. What? How I've never even used this before. I've never even used this. Looks like it's I'll have to look into this one, because see, this is one of those instances I'm like, well, what is this eye drops? I have to put this on the list of the eye drops that I need to use. So usually with eye drops, if they're preservative free, they're safe for contact lenses. If they say specifically on there for contacts or for contact lenses, then it's designed to be safe to be used with your contact lenses in. If it's kind of in the bottle, not preservative free, they don't specifically say it, then I would avoid it. Well, there we go. I'm putting that on my list. See, this is why I love doing this. You get, wow. Okay, let's see here. Here we go. So I've had dry eyes and blepharitis for many years here in Iceland. I've tried I I've gone monthly to eye doc for gland expression. Um, and so I guess I was wondering, oh, here's your question. I'm sorry. I guess this is the start. I'll come back to you. I'll promise I'll come back to you here in a second here. Okay. So I live on payments due to career-ending work injury from firefighting. I've noticed more and more floaters. Can pain medication hurt your eyes and cause floaters? Not that I know of, but my mom is actually in a similar situation. Um, or she was. So she was on pain meds for years, and I actually have documented photos of increased floaters with her. Now, it's one of those things where just in her age bracket, typically people have an increased floaters. So the question is, okay, would she have had these increase of floaters naturally, normally, without taking the medication? But she kind of has expressed similar thoughts where she's like, I feel like I've had more floaters since doing this. And so it could be just one of those coincidences. Hard to say though, but I understand my mom has the same thing, and we actually have photos of increased floaters. Not with her, it wasn't, it's not debilitating floaters. It's just kind of more an annoyance and nuisance. She like notices them in bright lights and everything, but she has noticed them more. Um, Not sure if it's related to the pain medication though. Okay, cataracts. What is cataracts? So inside the eye, right behind the iris, the color part of the eye, we have a crystalline lens. This lens is responsible for refocusing your vision. So if you look far away, the lens will be flat. When you look close up, it bends and allows you to focus up close and read, close up. Now, over time, that lens tends to grow, adds on layers, tends to discolor a little bit, and that's what cataracts is. It's like the discoloration um, and the aging kind of process of the cataracts, and it gets to the point where it starts affecting vision, causing more glare, and down the road could lead to needing cataract surgery to improve the vision. Okay, here we go. So a little bit more here. So I'm using BioTear eye drops alongside Manuka gel, Manuka eye drops. As the day passes, I get feeling that I have very much pressure in my eyes. That's something that dry eyes can cause, is what the next section on there. So symptoms of dry eyes can definitely cause this. So the symptoms of dry eyes is actually kind of overwhelming a little bit. I mean, it can definitely cause a pressure, also a strain type of feeling, light sensitivity. Sometimes when people are light sensitive, they'll also have that kind of same pressure type in the eyes. Now, as far as the eye drops causing that, usually not. It's usually it can be a symptom of the dry eyes. But I mean, bottom line, if you're kind of feeling an increased pressure or something's just off, you definitely want to check with the eye doctor to make sure that you actually don't have increased intraocular pressure. But they can sometimes that's the benefit of going to follow-ups with the eye doctor, is they can kind of assess your ocular surface, see what it looks like, see if you have inflammation, keratitis, how your oil glands are going, and match them up with the symptoms that you're having. And then down the road, if you're finding improvement, with your eye drops or the Manuka honey, you see them again, and like, wow, your ocular surface looks better. Maybe your oil glands are still clogged, but if you kind of match them, if the symptoms, maybe the eye pressure's gone down, then there's a good chance it was related to the dry eyes. And so that's what that can be tricky, but it's possible you can have that feeling for sure. Thanks for answering. You are welcome. Okay. Wow. Let's see. Oh, okay. So why does hay fever, non-specific rhinitis, worsen dry eyes? And so good question. So hay fever or people with allergies, sometimes it causes their eyes to excessively tear. And by excessively tearing, sometimes the case, might not be the case with you, but it can change the salt concentration of the eyes. So there's a certain osmolarity that the tears have, a certain pH balance. And when you have an increase of of tears or water. They're trying to flush out the allergens. Sometimes that can change the salt concentration and the pH balance and actually kind of make the surface of the eye irritated or inflamed. And so allergy and dry eyes kind of go hand in hand that way. And so it could be that it's changing kind of the osmolarity of the tear structure. And so that's pretty common. A lot of people will find that their dry eyes are worse during allergy season or certain conditions that they're in. Oh, I hope that's what you were asking. Okay. Okay, I've used dozens of eye drops and gels. What do you recommend as the best eye med for dry eyes? So, okay, this question is, thank you for asking this question, because this is the question that highlights the frustration that people have as they can try every eye drop, every eye gel, and maybe it'll help for a minute, but it doesn't really provide them like the best relief. And so the question a lot of people ask is, okay, what's the best eye drop? What's the best medication that I can take? And what's hard is it can be completely different for people. Like one person might love Manuka honey, which is not a prescribed eye drop, it's over the counter. They'll say, that's wow, that helped my dry eyes most out of any other eye drop. And some people will hate Manuka honey, like stings their eyes, doesn't help them, and they need prescription Restasis or prescription Xydra that helps them. So it's tricky to say, what do I recommend? What would I recommend to my patients as the best, eye medication or eye drop? I mean, there's certain eye drops that I usually recommend to start with, depending on where their dry eyes are at. If they're more meibomian gland dysfunction, if they're doing a lot of screen time. And I've done videos on that, like Sustain Complete. A lot of people start with to kind of cover both aqueous deficient meibomian gland dysfunction. But there's other eye drops out there. Apparently, I got to try Eye Fusion now, so I got to add that to the list there. But it's hard to just blanket recommend, hey, try this dry eye medication. I think it's going to work, because it's different for everybody. And yeah, I know that's not the answer you wanted. I know it. I know you're like, no, that's not what I wanted, but it's hard to say, because I could say something and you could say, no, I've tried that, or you could say, no, I hate that. It's just one of those things that just depends on the patient. Feel pressure and strain. My doctor measures the pressure. Oh, good. Okay. So yeah, a little bit more from him. So even I feel pressure and strain, my doctor measures the pressure in my eye and is within normal limit. Still, I feel the pressure in the eye. Okay, so that's good. So good that it's not good that it's not the pressure on the inside of the eye, that you are going to the eye doctor and they're checking that. So it could be a pressure or a symptom of the dry eyes for sure. Especially with the absence of other things going on. If you had an eye doctor look into it. Oh, good. Okay. So I recently started taking Ayurveda treatment. I'm feeling better. That's good. Okay, so I've been told that I have a freckle over my retina. Can anything be done? So a freckle or a nevus on the retina is most of the time benign, meaning it's harmless. It's kind of like having a freckle on your skin. We kind of treat them as watching a mole. So if you might have a mole on your skin, they might want to periodically take pictures and see if that mole grows in size or elevates or starts looking weird. But really, nothing to be done other than monitoring to make sure it's not going to turn into something worse, which would be really rare for that to happen. But yeah, so I have a lot of patients, like when we take pictures, I'll kind of point out, hey, here's a nevus or a freckle, and it's kind of like, what, I have a freckle in the back of my eye. But yeah, it's just the same as getting a freckle on your skin, but you kind of treat it as a mole, and they'll probably take pictures of it, but not scary. Can eyes get cancer? Yes, so sometimes that mole, in the rare cases, can turn into something bad. But yeah, eyes can definitely get cancer on the inside of the eye, front of the eyeball, eyelids, for sure. Thanks. Yeah, no problem. Okay, here's another one. So what is Tirvaya nasal spray you were saying? Can I buy it in India? So Tirvaya, excuse me, I think came out last year, and it's a nasal spray to treat dry eyes. So there's kind of a new form of dry eye treatment is something called neurostimulation, where there's a trigeminal nerve branch that kind of runs down our nose. And they found if you stimulate that trigeminal nerve, if you're able to stimulate that nerve, sends a signal to the lacrimal functional unit that tells your lacrimal gland to kind of produce more baseline tears. So you can get reflexive tears. You can pluck a nose hair and cause your eyes to water. Even like when you're actually doing it, it can cause reflexive tears that you might get from like pain or crying or poking in the eye. But it's actually been shown to improve the baseline tears. And it's a spray that's been designed to stimulate that trigeminal nerve, or or there's a eye tier 100 as an external nasal stimulator. Can you get it in India? I am not sure. I believe it's just in the United States. It's a prescription, so it's not over the counter. That's a good question. Maybe some other people might help me. If you're not from the United States, do you know if you've been able to get Tyrvaya in your country? I am not sure. Yeah, you could probably call your, if you have an eye doctor, you call your eye doctor about it and see if they have access to it or can get it or can prescribe it. So, okay, loaded question on this one. Is there scientific evidence that omega-3 helps decrease dry eye symptoms? Yes, there is. And no, there isn't. It's kind of a debated topic in the eye world as far as omega-3s are concerned. Some studies will come out and the studies will kind of like paint this picture that, hey, we did this study compared omega-3s versus like normal like oil, and there wasn't any difference. But you'll see some studies that will come out, and there are a lot of studies. I've seen enough studies where I've seen enough help from the patients that I am in the category, as well as myself, that I when I take omega-3s, it definitely helps with dry eye symptoms and overall dry eye. I think omega-3s is one of the things that I think most people should be on after consulting with their eye doctor, especially if they're dealing with that combination dry eye or meibomian gland dysfunction, because I think it has a great potential to help. The key is getting the right stuff, the right amount, and again, could be something that doesn't help everybody, but I am in the camp that it does. It can. Okay, thanks for doing live for dry eyes. It's been fun so far. So it's good for me. I'm suffering with dry eyes for more than 15 years. Several drops, eye gels, and they're effective. Please suggest. See this? So same question as before, and thank you for asking this, because this is again, this is the type of question where you can just feel the frustration in these patients. Like I feel the frustration in my patients and people on YouTube and other people where they just try different eye drops and gels and are like, nothing is working. And so there's definitely a thing to say about dry eyes and knowing what could be the core issue. And so that's why they've been coming out with new diagnostic tools and ways to figure out, okay, what's actually going on with dry eyes. Because, eye drops and eye gels, they are kind of looked as a Band-Aid in the dry eye world. They can maybe cover up some of the symptoms for a little while, or maybe keep you from getting worse, but doesn't really get rid of the dry eyes. And so if there's anything I can suggest, if you have access to an eye doctor that can start looking at your oil glands and the surface of your eyes and everything like that, because there might be some other things that they might recommend. I mean, maybe you'd be someone that would work really well with Manuka honey or warm compresses or omega-3s, type of thing. And so maybe the eye drops are just going to give you temporary relief, but in order to treat your dry eyes, there's, something more going on. And so, yeah, see, this is one of those things where it's hard to, I can't recommend something without seeing your eyes, because I really don't know what the core issue could be of the dry eye. So it's tricky. Yeah. Does the tear duct go to the nose? Yeah. So the drainage portion of the eye, the puncta and nasal lacrimal duct does drain into the nose. So the nasal, yep. Okay, so is LipiFlow the gold standard for blepharitis? Is there something better? And does LipiFlow reduce inflammation? Isn't available in Iceland. I want to fly abroad and try it. So I wouldn't say it's the gold standard for blepharitis. It's more designed to help treat meibomian gland dysfunction. So the actual meibomian glands. Now there is posterior blepharitis, and so it can help with that. Um, but it is kind of they're designed to help treat the actual glands, to help get them functioning again, get rid of the rancid oil that's in the oil glands, which can in turn help with blepharitis. But I don't know if I'd say it's the gold standard of blepharitis. Now there is one, IPL, intense pulse light. I was kind of mentioning that earlier, where that can help blepharitis as well, especially if you have Demodex blepharitis with mites. So it can decrease inflammation. I think probably decrease inflammation more than LipiFlow can. And so that's something definitely to look into, ask around for as far as like IPL, intense pulse light. LipiFlow, I'm not sure as far as like I'd go, heavy as far as like to treat the blepharitis or necessarily to reduce the inflammation. It can help, but I don't know if I'd consider it the gold standard. So adding real salt to your diet will help. If you're decreasing, like I was saying, like it kind of helps the osmolarity of the tears. And what foods contain omega-3s? Yeah, so a lot of foods, I mean, you're definitely looking at your fish. So yeah, so definitely there's a lot of diets out there that do not include fish, including pretty much the standard American diet. Nobody's eating fish, which or at least not eating enough, and we should be eating a lot more. But definitely there's omega-3 supplements, and that's what a lot of people will look into, and that's where it gets tricky is knowing which supplements might work the best or how much fish, how much omega-3s to get eaten. I'm working on a video about that, and yeah, if you haven't already, there's another eye doctor on here called Dr. Eye Health. Way bigger than I am, has a lot more videos on dry eyes. You've probably seen a lot of his videos. He just did excellent videos about omega-3s, and it's something I'm actually working on currently. So when I saw his video, I was like, wow, that's what I'm doing. Really good to look at his videos too. Can help you out. He did a whole trial run with omega-3 supplements for months, and then showed how it helped him. And I've done something similar. I've actually done blood work and showed that omega-3s actually help me. I should be doing a video about it. But yeah, his video is excellent. So definitely check into that here. Okay, I just have time for a couple more questions here. Man, see, I could talk about this for hours. So it's fun though. It's fun. Okay, so here, can dry eyes cause anterior basement membrane dystrophy? I was diagnosed with by a corneal specialist. Sorry to hear that. Currently on erythromycin 4 times a day to see if it will heal on its own. So dry eyes can definitely make the symptoms worse. So a lot of times with anterior basement membrane dystrophy, it can be genetic related. But yeah, dry eyes can definitely, in a way, it can cause it. So here's an example. So if you have dry eyes to the point where you have keratitis or maybe corneal erosions that are where the cornea is kind of being torn away or separated, and you're left with these kind of open wounds. Sometimes that can be a combination of having a basement membrane dystrophy, because that the corneal layers are just not adhering correctly. They're not sticking together well. And then you add dry eyes on top of that, where the eyelid just kind of, rubbing onto that cornea, and it's really dry. It's kind of like Velcro, and it can rip it off there. So in a way it can cause it, but more it's kind of it can make it worse type of thing. Sometimes people have this dystrophy, and then when they have dry eyes, it can, make it worse. I hope it gets better. Yeah, erythromycin, you want to kind of, help, get rid of the blepharitis if you have it and all that. So they probably have you on some teardrops too, maybe. Cod liver good for your eyes? Whew, this is a good question too. And I want to do a video because a lot of people ask me about this. Been looking in the research. There's not a lot of research on there. There's research trying to decide, like if you're talking about actually putting like, it right on the eye, or there's somewhere you can like ingest it type of thing. Um, and the research is kind of more of dosages and application usages and stuff like that, and that's kind of what I'm into. And so it has been shown that it can be good, but sometimes too much can be detrimental. And so so I'm still kind of like looking into that to see if I can learn more about it. So hopefully I'll have a video that can go into more detail about that. I want to. Okay. Is a blood drop a replacement for drops in case we're in a place without access to a pharmacy? So, so when you say blood drop, are you talking about the serum tears that you can get made? So a dry eye treatment is you can get a blood draw, and they can make artificial or a certain eye drop made from your blood that kind of matches the structure of your eyes a little bit better. I'm guessing is that what you mean? Blood drop replacement for drops in case we're in a place without access to a pharmacy. Hmm. Well, the serum tears is a good replacement for eye drops for artificial tears because it can be definitely more specific to your eyes. Hoping that's what you meant. Maybe I'm off there. Okay. Oh boy, here. Okay, my ophthalmologist is recommending either Activa mask for 4 weeks or Tixel. Tixel was the evidence of either treatment to reduce evaporation. So are these Tixel? Which one's Tixel here? Tixel, what? Oh, thermal energy of the skin around those. Oh, okay, yeah, okay, gotcha. Yeah, so thermal energy of the skin around the eyes. So it can be similar to kind of how IPL works, where it can help reduce the small blood vessels in the eyelids, help reduce inflammation, and it can help reduce evaporative dry eye for sure. Now, as far as that compared to IPL, I'm not sure. I'll have to look into that. But it sounds similar, but I think that's actually uses a real laser where IPL is intense pulse light. So kind of a different category there for sure. But yeah, you see how many treatments are out there? I mean, that's crazy. Can cataracts go through different stages? Yep, for sure. And there are different types of cataracts. Some people will have low, mild cataracts for years and do fine. Okay, let's see here. Oh man, I only have a few more minutes. You guys are great. Any tips for when you fly, stay in hotels and can't really control how much AC get into your eyes? Ooh, okay, this happens to me. It's the worst. Worst to me. I woke up with a lot of pain in my eyes when I travel. Okay, so I actually deal with this. So when in fact, I went to CE in Utah just this last weekend, kind of, and I just experienced this. We had the AC going. The AC was really close to where my eyes were, and woke up with crazy dry eyes. I'm like, I should have known. I'm an eye doctor. So the thing that has worked the best for me, and this may not work the best for you, is I actually am really liking, if you haven't heard of it, Sleep Tight, Sleep Right. So it's a tight eyelid tape. I know that sounds crazy, but it's an eyelid tape where, you go to bed, tape the eyelid shut, and it seals the eyelid properly so you don't accidentally have an inadequate eyelid seal or a gap where the air can get in there and dry the eyes out. It definitely helps me a lot, and that helps me better than using like gel drops before I go to bed or wearing a mask. I usually type the eyelids shut, but some people don't like that. But that's the thing that I would use traveling and probably will. Can dry affect your glasses prescription? Unfortunately, it can, and that can be tricky when we're checking a prescription to have someone get new glasses. Dry eyes can definitely fluctuate the prescription around. They might blink and want a different prescription, and then their eyes will dry and then want a different prescription. So there's a lot of fluctuation there. And an eye doctor kind of should be able to kind of know or determine, hey, this fluctuation is kind of weird, and start to kind of catch on a little bit. And so Sometimes we'll have to put drops in or maybe do it on a different day or treat the dry eyes first type of thing, but it can, unfortunately. Okay. It turns out that I have lacrimal gland issue. I have tearing and chronic puffy eyelids. I got Ilux, but the doctor burnt my eyelid during the procedure. Is there a way to draw out the puffiness in my eyelid? Wow, sorry to hear that. So you have a lacrimal gland. So the lacrimal gland is usually the top of the eyelid, kind of helps produce the water part of the tears. Puffy eyelids can be from multiple different reasons. Eye doctor was doing Ilux. That's usually to treat the meibomian glands in the eyelids, to help help the oil glands, maybe reduce the inflammation. So puffiness of the eyelid, that can be, I don't know if you're having like swelling like me this morning. I don't know if you noticed that I have little puffy eyelids down there. I had a late night and probably ate too much salt. That's usually like kind of what gets me, so lack of sleep. But some people have puffy eyelids from actually dry eyes or blepharitis, problems with their oil glands. IPL can be good for that, to decrease the inflammation for sure. Cold compresses, if you're like kind of more allergy, kind of puffy eyelid there, diet type of thing. Man, I am sorry to hear about the Ilux. That probably makes you nervous about doing any other procedures like that. It'd make me nervous. Burn your eyelid. Dang. Okay, sorry. Okay, so more about this. No, I'm just doing a blood drop, like people with diabetes, and put it in the corner of the eye. So you're talking like your blood? Huh. I haven't heard that. I don't know. It takes a thermomechanical ablation. Yeah, so you can, ablate, certain things on the eyelid type of thing. Okay, so not necessarily to reduce the inflammation. Thanks. Missed one. Hi, does corneal cross-linking stop keratoconus progressing over time and also progressing from rubbing or just one? So corneal cross-linking, so I usually don't tell people that it's going to stop the keratoconus, because it's not necessarily a cure, but it can definitely slow the progression down, just because sometimes when people get corneal cross-linking, it can still progress a little bit, or sometimes it can halt it. I mean, I've seen people where it just kind of stops, but I usually don't phrase it like that because it's possible it doesn't. But yeah, it can help or keep it from progressing over time or slow it down. And also progressing from rubbing. You still want to be careful with the rubbing, I mean, for sure. So rubbing it helps, the corneal cross-linking strengthens those fibers. So it does strengthen any change to the structure of the coning. So it will help if you do rub your eyes. It still helps slow down the progression, but you still want to be careful with the rubbing there. Okay, let's see. My eyes stay open when I sleep, and I get extremely dry every morning. They hurt to keep open for a few minutes, then fill with tears. Could this cause long-term damage if I don't fix it? Yeah, so this is along the same lines. So I kind of wake up with dry eyes as well. Helps me to use Sleep Tight, Sleep Right. There's the home hack, the Glad Press and Seal that you can put on there to block the eyes. Kind of irritating the skin though. I like the skin tape better. And and it can, if your eyes are bad enough, like if your eyes are open enough and can dry out enough, then yeah, sometimes it can cause ulcers that are caused from dry eyes, that can cause scarring and can change your prescription, your vision. And so, yeah, that's something you definitely should get addressed to hopefully help that in the future. Sir, can IPL therapy work also for aqueous deficient dry eyes? Not necessarily. It could, because usually people have the combination aqueous and evaporative. But if you just have the aqueous deficient dry eyes, might not be as effective as other treatments there. But IPL is one of those things where it can help a lot of different things. So if you're still looking into IPL, it can still can still help, but if it's just aqueous deficient, might not be the best. Okay, so more on the blood. He said it was a new technique that our blood is the most similar to our tears. Yeah, just I know that you can make serum tears, so it's a drop made from your blood. You get a blood draw. But I've never heard of someone just putting blood in the eye, though, like a blood drop. Get your blood and put it in your eye. New technique. You have to look into that. Okay, I'll have to do this. Has to be the last one. I'm at the hour mark already. I told myself I was going to do 30 minutes. See, man, every time getting a dry eye. Sorry, but you guys have been great. Okay, how's your dry eye routine? What products do you use? Okay, good question. I actually do have a video about that. So I actually go over dry eye routine. Sometimes I try and try different things. So here's what's tricky about my routine. So you might not want to take my advice, is because I am trying. So I have a dry eye routine. That's a thumbnail from one of my videos I did right there. But so sometimes I'll actually kind of stop a lot of my dry eye treatments because I want to test out a new dry eye treatment to see how well it works on me. Either to do a video about it or to know what the patients might expect. And so sometimes that works. Sometimes it backfires because then my dry eyes kind of go crazy. But when I am in a routine, I deal with a lot of blepharitis. So I am along the same lines as, I use hypochlorous acid solution, eyelid wipes. I usually use both of those. And then I do warm compresses to help with my oil glands. I usually use the Tear Restore eye mask nowadays just because I like to be able to watch TV while I'm doing it. And then I do use eye drops every once in a while, usually in the morning. But that's kind of more of my routine at night is hypochlorous eyelid wipes, warm compresses. And I definitely clean the eyelids, whether it's the eyelid wipes, I'll usually use new lids or another device to kind of clean the eyelids. But like I said, I don't know if you want to follow me because sometimes I'll stop that completely and try something else. So for example, with the Manuka honey, I did that. I kind of stopped my routine and did a Manuka honey, test for a month and just to see it. But the products I use are usually Tear Restore. I use their wipes. Those are still my favorite. The hypochlorous acid solution. You can get any one that's in the glass bottle with it, whether it's Avenova or the lid and lash cleaner. So yeah, those are both great. And then I use the Tear Restore mask is what I still use when I'm in my routine. Okay, so hey, thanks everybody. Everybody's saying thanks. Thank you. I mean, honestly, I feel like I improve as an eye doctor when I do these types of videos, when I'm looking into dry eye research, dry eye videos. It helps me be a better doctor to my patients. So really it's, I should be thanking you because you guys have great questions. Makes me want to look into things. I put lists down when people ask me a question and I've never heard of it. You just saw that live. And so that's exactly what happens in the comment section is people ask me, hey, what about this? And I'm like, wow, what is that? And then so I put it on my list to hopefully try it. And then I kind of go from there. And so thank you for all the comments. Thanks for being here. If just to end the video, if you want to look into more of my other dry eye videos, I'll put a link for my playlist up there. But hopefully everybody can find improvement to their dry eyes. Stay focused out there, and I'll see you in the next video.